Hey, Dr. Lawnin.
Hey, how are you?
I'm good. How are you?
I'm great.
I wanted to take a moment to talk about something that's been coming up a lot lately.
Okay.
Dental insurance and what's happening in the marketplace. It's a hot topic, and I'd love to ask you a few questions about what you're seeing on your end as a dental office.
Absolutely. It is a hot topic right now, right? I think all healthcare and health insurance in particular is a hot topic, but particularly in our office, it's probably one of the most common questions that we get. So I would love to talk with you about it.
All right, so can you first explain how dental insurance started?
Yeah, that's a great question. Around the 1950s on the west coast of the United States, the longshoremen, these are guys who would help boats and things at ports. They had a collective union and they negotiated the original dental insurance. So when they negotiated the original dental insurance, it was a benefit that was provided to them. Really not any different than medical insurance at your company, but it was a way just to provide a little extra support. And when it started, the original benefit was at around $1,200 to $1,250. And at the time in the 1950s, that was enough money for somebody to have all of their teeth extracted and to have dentures placed. And so it was really a huge benefit to these guys. And it was intended to be a wonderful benefit for them that would help them, kind of take care of their teeth.
All right, but what's different about dental insurance today?
Yeah. What's really fascinating is that dental insurance is very similar and very different from that original plan. So one of the things is the differences, right? At the time when they started it, the original premiums per person were somewhere in the $10 range. Today, the premiums are somewhere around the $70 range. What's not different, unfortunately, is the benefit. The average benefit today is somewhere between $1,200 and $1,500 per year. And I know what you're thinking. Holy, that really feels unfair. And in some regards, it's difficult as a patient, it's difficult as dentist because what was started off to be such a wonderful benefit has kind of gotten morphed into this really misunderstood and misused item. It's not what it once was. To give you an idea, as I referenced earlier in the video, the cost of taking all your teeth out and replacing them was about $1,200, $1,250 at the time in 1950s when this started. If you took that and ran it through an inflation calculator, the inflationary rate for that would be around $20,000. And that's about what it cost at a dentist office today. But dental insurance has not continued to meet that need. That's the big difference, unfortunately.
So as a dentist, how do you view dental insurance today?
That's a great question. I view it as a supplement. Unlike some things, what it was traditionally or what it was started off to be we'll cover all your needs, it's no longer that. Now it is just a supplement. It helps. But unfortunately, for pretty much every patient, it's not going to cover everything. It is really nice if it's offered to you. It is a benefit if it's offered to you, but it's just a supplement. It's not intended to cover the entire cost of any procedure or fixing things. It's intended to just kind of help a little bit. And that's how I view it. And that's how patients should view it.
How does dental insurance compare with other kinds of insurance like medical or homeowners or even life insurance?
Yeah, that's a great question. Medical insurance, which is also a hot market and hot topic of discussion right now, is actually much more similar to homeowners insurance and life insurance. What do I mean by that? Well, life insurance, homeowners insurance, and medical insurance all insure against catastrophic issues. So, for example, life insurance, if a family member passes away, it gives money to the family to help supplement and help them survive. Homeowners insurance, is a great example. If you had a small leak and it would cost you maybe a few $100s to repair or even sometimes a couple of $1,000s, you probably wouldn't file that to your homeowner's insurance. You would just pay that out of pocket. But if a wing of your house or a room caught on fire and had smoke damage, you would absolutely call your homeowner's insurance and they would pay for a much larger damage and issue. Medical insurance functions very similar. Although there is some preventative care included with medical insurance, a lot of the times, like if you need a small medical procedure, that's not going to reach the level of your deductible. And so you'll pay out of pocket for that. But if you get into a car accident with medical insurance, you will pay your deductible and then they will cover the rest of it. Because sometimes it might be a very long hospital stay for those, or if you have a big medical incident or procedure, they would cover the very large bill that would come. Dental insurance is entirely different. if you fall and knock out all your front teeth, your dental insurance isn't going to cover any of it outside of what that annual maximum. In a lot of cases, that's around $1,500. So, for example, a dental implant costs around $7,000 to $8,000, and you're going to get $1,500. It's just really hard because when you hear insurance, you think of medical or homeowners or even auto or life insurance, but dental insurance functions entirely differently. And that's really hard for a lot of our patients because they hear the term insurance and they think it's going to cover all this stuff. And in reality, it doesn't. And that's just not quite fair, in my opinion.
What does it mean that you're a non-contract provider? How does that change the level of operation and care and how things operate in the clinic?
Yeah, what it means as a non-contract provider is that dental insurance don't come in and arbitrarily reduce our fees. And there's a reason we've chosen that. I'll use Delta Dental as an example, although all of them are the same. In 2008, during the financial crisis, Delta Dental across the board cut most reimbursement rates by about 30%. At the time, now this is a couple of decades ago, at the time, they set the reimbursement rate for a crown, for example, at around $800. And since then, they have not noticeably raised their reimbursement rate. The reality is that our overhead has continued to increase, our prices, our staffing cost, everything has increased. But Delta Dental has not changed that reimbursement. Every dental office works a little bit differently, but sometimes in-network offices have to figure out a way to make up that money, either through higher volume, meaning they're diagnosing a little bit more, or through kind of supplemental fees. So sometimes you'll see offices, not everyone, but sometimes you'll see in-network or contract providers, say, hey, well, we're going to do a crown, but they're not going to cover the ceramics, so we're going to do a ceramic fee on top of that. It's just a way for them to get some of that money and fee back. I don't view it that way. I don't think that that's fair, and I don't think that that's how it should operate for people. Out of network or out non-contract provider means that our fees are our fees. If you come in and you pay cash or you come in and want to use your dental insurance to pay, our fee is the same for every person. It's the fairest way for us to do it. But our fees are set by our cost. It means that when I set a fee, I can use the materials that are the best. I can pay my staff fair wages and help them. I can train my staff and spend money on these things. I don't have to make compromises or cut corners on cost so that I can provide the highest level of service possible. Is that difficult for some people? Sure, I understand. But the reason we've chosen to be a non-contract provider is so that we can provide our patients with the best level of service, and so that the insurance company can't come in and say, well, we want to just pay you this.
Can you share why you chose to be a non-contract provider? What are some experiences or observations that led to that decision, and how does it compare to being in-network?
I used to work in an in-network office. And what I would find a lot of the times is my treatment was being dictated very much by the insurance company and not by the patient's needs. And that was really, really difficult for me. The reason I'm a non-contract provider is that I want to treat people with the best possible outcome and the best possible solution. I don't want to have to cut corners, use cheaper materials, use less trained staff. I don't want to have to use older things that aren't as accurate or less technology. In fact, I want to do the exact opposite. I want to provide the highest level of care that I possibly can. A couple of great examples that have come in and across my desk are just kind of reimbursement rates. Unfortunately, dental insurance reimbursement rates haven't really increased as time has gone over the last couple of decades. And so now a lot of the times these insurance companies will reimburse people at a lower rate than what they're actually paying their staff and what they have to pay their staff in the market. We had a lady, she's a wonderful patient, and she has a dental insurance plan. We got reimbursed about $60 for her cleaning, exams, and x-rays. And to give you an idea, that doesn't cover the overhead on my staff. That doesn't pay the hygienist a fair wage. And I'm not talking like an exorbitant wage. I'm talking what the marketplace in our town in Houston is. That wouldn't meet that standard. So I'd either have to hire somebody with less experience or no experience, or I'd have to give them a huge discount, which I don't want to do, or I'd have to lose money on that patient. And the reality is I'm running a business. So losing money on that patient isn't really a viable option. There's two ways that we would address that. First is we'd either have to find a bunch of work that doesn't really need to be fixed, and I don't like that. That option stinks. I'm not going to do that. Or the second option is we would just turn that patient away. And that really doesn't feel like a great option to me either. That's really the challenge of being a dentist, is that people come in and expect this dental insurance to be everything should be taken care of, but it just doesn't. They're not keeping up with times.
What are some good things about dental insurance? Why do you like it?
Oh, there are a ton of benefits, right? Particularly if you're getting dental insurance through a company. It is absolutely a benefit. If your company is supplementing that cost, you should take it 100%. It's a wonderful tool to help you maintain your teeth, right? Dental insurance today really functions best as a supplement for good preventative care with a little bit of chipping in for maintenance things. What do I mean by that? It typically will cover a decent amount of your cleaning, your biannual cleaning, your exams, your x-rays. So it's a wonderful benefit in that. It will also, if you need to have a filling replaced or sometimes even have a crown replaced each year, it will cover that. Unfortunately, if you need larger treatments, things like root canals or orthodontics or implants, or even, let's say your smile is worn down over years and you would like to restore it, the dental insurance isn't going to do anything. It really doesn't help. But I love it as a tool, particularly for people who have kind of already reached their health or are happy with their smile. It's a wonderful, wonderful tool, especially when your company's offering it as a benefit.
All right, so that leads me to my next question. If somebody was given dental insurance through their company, do you recommend that they take it?
I do. At least in the regards of if the company is supplementing the premium, right? The average dental insurance premium, and it can vary pretty dramatically, but it's around $70 to $80 a person. Right? We run that out. That comes out to about $1,000 a year. The reality is, to make the math work, you need to use almost all of that stuff, though. If you're a person who has a cleaning and exams and x-rays, won't use all that. That means you have to get some work done. If you're getting this through your company and they're supplementing, so let's say you only have to pay $20 to $40, then it makes a lot more sense. I absolutely think you should get it. Now, if you're paying for it as a private individual, it's not always a win for you. And that's what I like to talk to patients a lot about, right? If you're paying $80, or sometimes even I've seen plans that are over $100. If you're paying that much, let's say you're paying $100 a month for a $1,200 plan, you're basically breaking even. But the real difference in dental insurance is that you pay that $100 a month. If you don't use that $1,200 benefit, it vanishes. It doesn't roll over year to year. So let's say you came in and all you needed was a couple of cleanings and your total bill for the year was like $600. You've lost the other $600. And that's where I really don't recommend it for patients. Instead, I talk to patients a lot about, if they're paying for it themselves, considering self-insuring. And what does that mean? It means taking the money, the $100 that you would a month, and putting it into an HSA or a savings account, and then becoming kind of your own insurance company. That, I think, makes a lot of sense if you have to pay out of pocket.
All right. Thank you so much, Dr. Lawnin. This has helped us a ton.